SSI to SSDI, because obviously there's two different standards there. Many don't qualify in the next level, and I want to make sure that we're actually managing that handoff well. We can talk about that later, or I can try to submit that for the record.
Great, thank you.
Thank you.
Governor O'Malley, Mayor O'Malley, Commissioner O'Malley, whatever title you're using now, welcome to our committee. It's good to have you here. I know that you have visited all the regions. You've commented about that. I think that's a good thing to do, to really try to understand the challenges that are out there in the field. And I noticed that the next generation of your stats is security stat. And I think that's going to be very helpful for all of us, including your workforce, to be able to have metrics in order to judge the progress that they're making. But I just really want to, this is a hearing on the president's budget. And if I understand, the president's budget would give you a 1.2% for administering the benefits outlays. And I just want to go to this one chart that you presented and make sure I understand this correctly. If we fund the president's budget, one of the major complaints we get is the wait time on the 1-800 number. You're telling us that with those resources, you can reduce the wait time from 38 minutes to 5 minutes. Am I reading that correctly?
I can't say that. What I can say is that we believe that we can bring it down by its current roughly over 30 minutes. It's roughly, the last full week of reporting we had ended March 8th, and it was down to 31, which is a better trend line. We've been wrestling it down. I believe that with the president's budget, we could bring it down another 20 minutes to more like to an 11 or 12-minute wait time.
And then long-term, with that support, you believe you can bring it down to within 5 minutes?
I believe with further strides, we can bring it down to 5 minutes. And in fact, in the field offices, the wait is 3 to 5 minutes for the field offices.
And the other issue that we hear about all the time are the disability determinations, the time from the initial disability or reconsideration decisions, which now goes about 2/3 of a year. You're saying you can bring that down also. Can you just talk a little bit more about the trend line there?
Yes, sir. That's going to be a longer task, involves more training. But in essence, we would plan to use $2.8 billion to restore the staffing losses that have happened over the last 9 years when we've gone without even having a budget hearing or an appropriation hearing. Some of the greatest attrition has happened at our state DDS offices. So we would use that $2.8 billion to hire up again. All of these 50 are state employees, as you know, that our federal dollars pay for. Each of those offices has different leaders and faces different challenges. But if we can we need to get their staffing back up. We've also designated some cadres within the federal aspects of the agency that can help bail out those DDSs, but that's more like emergency work. That's the longer term is we have to get the staffing back up in those DDSs, and that's the biggest chunk of the president's, the additional dollars in the president's budget.
And then the wait time for a hearing decision itself. I'm not sure how the budget directly impacts that. Maybe you could explain that a little bit.
Yes, sir.
It's sort of shocking it's a year for those decisions.
Yeah, I will do my best. There are in essence, kind of 3 stages to a disability determination. The first one is the initial stage. That's a process. It begins with in-person application at the field office, then it goes from the field office to the state DDS. And there it can sit. Used to be 120 days. Now the average time is 228 days and has every indication of rising as their attrition, in fact, rises. If you are denied that, your next level of appeal is to go for a reconsideration in that same state office, which also takes another 220 days.
And how does the president's budget attempt to address that delay?
With greater staffing, we will be able to process more cases more quickly. It's almost like a school system where all of your staffing is in teachers. If you have rising numbers of students, and declining numbers of teachers, you're going to have greater class sizes. By way of a metaphor, well, with fewer staff in the DDS, the number of cases per each case staff worker goes up, and therefore the wait times become longer.
I would just point out 1.2% seems like a rather low amount for an administrative cost for a program. I don't know too many private sectors that can administer a program at 1.2%. And I would also acknowledge that we have a trust fund, and you have been disadvantaged because you're counted in the caps that we appropriate for, even though it's trust funds.
Yes, sir.
We believe you should be budgeted, you should have oversight, but why it's included in the domestic spending caps is somewhat a mystery to many of us.
Yeah, I don't quite understand it either. I've never served in the federal service until now, but it would seem to me for all of those years that I worked and you worked and we were paying our FICA, nobody asked us if paying into Social Security was a discretionary act on our part. So I'm not sure why suddenly those same FICA dollars that had always supported a high level of customer service are now, in essence, being cut. Before 2018, we operated on about 1.2% compared to annual outlays. A company like Allstate operates on 19.4%. Liberty Mutual, Liberty Biberty is 23.6% compared to annual outlays. Social Security traditionally had been 1.2%. We are headed to a 27-year low with the highest number of beneficiaries, and it would also be the lowest year in terms of that percentage. Now, the president's budget gets us back up to 0.96 of 1%. Over the next couple of years, you could even now, and it's not really even an appropriation in the sense that it's an allowance. It is allowing us to use the payments that workers have made over the years, not only for their benefits, but for the customer service to access them. And I think 1.2% is not much to pay for high level of customer service for benefits we've already earned.
Thank you. Senator Bennett.
Mr. Commissioner, it's great to see you. Thank you.
Great to see
Thank
you.
you for your willingness to serve. And I know you're new to the job, so what you're hearing today is not many things that you haven't been able to address directly. But I just on that point that you're making about changing demographics, the more retirees, the fewer people to support them. I mean, what do you think we need to do to not just